one thing that I am 100% sure about is that on the NCLEX exam, you are definitely going to get prioritization question, right? And you can get anything more than 10 on the NCLEX exam. Now,
Mm.
uh, this is the reason why I make sure a lot of my students master what? Prioritization 100%. If they cannot achieve 100%, at least 80 to 100%. Right. That way, this is it. Now we have my goal is to make you pass the NCLEX exam in its 5 question. Right. So if I want to help you pass the NCLEX exam in its 5 question as well to apply strategy to it, now I ask myself, what are those questions that show up on the NCLEX exam the most? One is what? Your prioritization. Right. Now, since I know prioritization show up 100% all the time on the NCLEX exam, and you can get more than 10 as what? RM, because you are taking what? The NCLEX RM. So now if you get more than 10 and then you have 85 questions. Now, one thing I know for sure is that 15 question is unscored, so we have 70 question. Now, if you remove 10 question from the scored one, we have 60. Now, based on my understanding, right, to be above the passing standard, let us say 35, 35. If you have more than 35 questions correctly, you should be above the passing standard. Right. So if out of 35 questions, we already know 100% you are going to get prioritization question on the NCLEX exam more than 10. Right. Let us remove 10 from this. Then we are left with 25. Right. So we can start figuring out other things that can like push us above the passing standard. The only twist I just do is this, because normally 15 is unscored, right? We are left
Mm.
with 70. The average should be 35, right? At least one will be what? Above the passing standard. But we don't really know what are they calling it? Where the NCLEX will take the 15 question, because it will be taken randomly. It might be part
Yeah.
of this 35. That is the reason why I just add the 15 alongside with it. Then I have 50 over 70. But 50 over 70 or 35 will definitely put us borderline, right? And we don't want to be borderline. So plus one that will take us like above that borderline. So that will be 51 over 70. So to pass the NCLEX exam, at least you need, what am I saying? It's not 85. It should be 85 because I've added the 15 alongside with it. So 51 question correctly over 85 in order to pass the NCLEX exam successfully. Now, so this 51, I asked myself, I said, what are those questions that show up the most on the NCLEX exam? I know those questions that show up the most on the NCLEX exam. If I can drill this part to any student, they have the ability to pass the NCLEX exam in 85 questions. And that's the reason why over the years, I've been able to help more than 500 plus nursing students pass the NCLEX exam in 85
Mhm.
questions. People feel like, wow, coach, I failed previously before in 150 question. Some I failed in 90 something question, this and that. No, the truth is that you don't understand the NCLEX, right? We don't only want to study, right? We also want to be what? Smart about it, right?
Yeah.
The moment you can be smart about it, you also, there are a lot of things that can cause one to fail. It's not because they don't know how to study. Most of the time, the way we study, we don't study the smart way, we study the hard way. We study a lot of things, and most of the time, we don't even know what is on the NCLEX exam. So our reading tends to be all over the place. Right. So I know for sure, as I said, prioritization is going to be on the NCLEX exam 100%, and you're going to get more than 10 questions. Yes, for sure. Now, if there's a way I can kill in prioritization and then you are within what 80 to 100% success rate with prioritization, that way, if you have 10 prioritization questions, you are 8 correct answers, right, above the passing standard. So before you will fail the NCLEX exam, right, you have to get 8 answers wrong to fail the NCLEX exam. And for sure, it's not only prioritization that is on the NCLEX exam. So if you have eight, at least minimum eight correct, there are other areas you are going to get more points that you will build this, not only eight, and you might just have 20 correct answers above the passing standard. That way, to fail the NCLEX exam, you need to get 20 answers wrong. Now, this is the truth that you need to know. NCLEX is not difficult. The problem is a lot of people have studied so well, like they have studied so well, like they know how to answer question, but they only know how to answer program question bank. They don't know how to answer what? The NCLEX question, right? Because the way the NCLEX question is written is different from the way your program question is written. NCLEX question is
Exactly.
written in NCLEX question is written in three structures. Now, the structures are there because of some certain way NCLEX wants you to break down the question. Now, nursing school question, let's talk about nursing school question, program question, and NCLEX question. Nursing school question, program question, NCLEX question. Now, nursing school question tests you generally on knowledge, and it's a mixed thing. It's mixture. Like now, if nursing school want to test you on hypertension, let us say nursing school want to test you on hypertension, right? They can mix things related to diabetes in it, things related to stroke in it, things related to MI in it. This don't happen real life. Right. Why are you going to tell me I'm taking care of a patient with hypertension and you're missing something related to stroke, diabetes, and MI in it? Make no sense. But it makes sense to nursing school because the whole goal of nursing school question is to see if you can differentiate between what hypertension and diabetes, hypertension and stroke, hypertension and what MI. That is the whole goal of nursing school. They try to build that knowledge. Now, that knowledge, NCLEX now want you to implement that knowledge into what we call practice. Now you need to practice with the knowledge. Now we know NCLEX is aware that you know everything about hypertension. NCLEX is aware that you know everything about diabetes. NCLEX is aware you know everything about stroke. NCLEX is aware you know everything about MI. So they will give you hypertension patients now and ask you to care for that patient. So on the NCLEX, they are not going to mix anything related to diabetes, stroke, MI when they are testing you about hypertension. Every information will be related to hypertension. Every treatment will be related to hypertension. Every procedure will be related to hypertension. But because we still have that nursing way of thinking, sometimes we feel like NCLEX is trying to trick us. So every answers on the NCLEX exam, we don't trust it. We try to question the answers. Answers on the NCLEX exam is not there for you to question. NCLEX is just wanting you to spot that particular thing that shows that that answer is not what safe for a patient with what hypertension. That is where the idea comes in. NCLEX test on safety, but a lot of students don't understand this because they still think like what nursing students. Right, it's not their fault. The problem is that we, instead of finishing nursing school and understanding the NCLEX, no, we did not do this. We finished nursing school all the way to getting what? A program. And the program don't tell you about the NCLEX. What will the program give you? Program is going to give you what? Question bank. Now, you are not learning about the NCLEX. Instead, you are answering just question without perfect understanding about what? The NCLEX. Now, guess what? This is what I tell a lot of students. Now, if your roadmap is like this, if your roadmap is like this all the way to program and then question bank, then this is what you are doing. You are just giving medication, right, to a patient without not knowing what their diagnosis. And guess what? That way you are putting this patient at risk because you don't know what their diagnosis. Now, that is the same way you put your exam at risk. You go on the NCLEX exam, you don't even understand the question, you just have an idea of answering question. Now, you don't understand the question, you don't even understand the mindset of what? The examiner. So you are just answering the question. I call that what? Gambling. And at the end of the day, it gives you 50-50% of passing the exam. That's the reason why a lot of people, when they finish the NCLEX exam, they are not even sure whether they pass or not because the exam got a big one on them. Right. But when they finally pass, they are at rest, they are happy, and something like that. But this is not the way you want to go on the NCLEX exam. I want you to go on the NCLEX exam in a way that you are so confident, you have that clarity, you understand what the NCLEX is testing, and you are applying a lot of principles. Not because of you really understand what the question is saying, but you know how to answer question as a test taker. Because I can guarantee you, you will go on the NCLEX exam, some question you might not understand them, but I can also guarantee you that 70% of your question you are going to understand them. And 70% is enough to pass the NCLEX exam, not in 150 question, but in 85 question. That is how crazy it is. So now, I'm definitely going to give you one of those principles you need to know for prioritization that will guarantee you 80 to 100% passing of prioritization question if you have more than 10 questions on the NCLEX exam on prioritization. Now, the miss out part is understanding the NCLEX. Now, NCLEX is about safety, right? And safety is not only when patient is going to die. Safety have to do with the physical aspect of the client, the emotional aspect of the client. Let me say physical, yeah, physical, emotional aspect of the client, right? The physical, emotional aspect of the client. Now, the ethical aspect as well of the client. Safety is in all this. That's how NCLEX test safety. Now, for NCLEX to test to see if you are a safe nurse, NCLEX use 6 concepts. I keep on saying this concept all the time. Now, first concept NCLEX use is what we call caring. Second concept NCLEX use is what we call nursing process. Third, clinical judgment. Fourth, communication and documentation. Then we have culture and spirituality. And then we have the last one, teaching and learning. This is the concept NCLEX use. Now, NCLEX has explained all these concepts in a way that when you see a question and you can easily identify if it's a caring question. When you see a question, you can easily identify if it's a nursing process question or clinical judgment question, communication and documentation question, culture and spirituality question, teaching and learning question. Now, for students that have taken the NCLEX exam before, trust me, this is it. You have seen that kind of question on your previous exam. You saw
Mm-hmm.
question that the first part of the question is saying you are teaching a client about so and so. You saw questions like that, right?
Mm-hmm. Mm-hmm.
All right. That is question under what? Teaching and learning. You saw question like you attended a staff education program about. You saw questions like that, staff education program.
Yep. Now that I'm with you, it's management of care, right?
Yeah, management of care. Uh staff education program can also be a lot of things as well. So not only related to management of care, can be for other area, but it depends on the educational program. Right. If the educational program is about confidentiality, so confidentiality is a content under management of care. But this is the concept NCLEX is testing, despite the fact it's a management of care content, which is confidentiality. You can also teach a patient about multiple sclerosis. Multiple sclerosis is physiological adaptation content. Right. Now, but it's also carrying what? Um, staff education. Staff education is what we call learning. Right. Teaching is when you are teaching the client or you taught the client, you see the question, you taught the client about so and so. You are teaching the client about so and so. Learning, you attended a staff education program about so and so. Or the question be like, you attended a staff education or you are contributing to a staff education program or you are planning for a staff education program. That staff education program is always there. Go and ask any other person that have taken the NCLEX exam. That is how it is written. Is it that it's teaching or staff education program? Why is it like that? Because that is the concept NCLEX is testing. Now, the secret is this: in that concept, there's a strategy or a principle you apply. I don't really call it strategy. I call it principle because it's not a strategy. It's a principle that lives long before we even decide to start doing nursing. Right. The principle of teaching and learning. The moment you can understand that principle related to this one concept, you know how to answer the question, you know how the examiner is thinking, you know what the examiner wants, and you know the right answer to that question, even when you might not even know anything about the question. That is how powerful it is. That's the reason why I strongly teach students what concept. Now, culture and spirituality, easy. Now, I don't struggle with culture and spirituality question on the exam. Why? Because once I see anything related to patient cultural lifestyle or spiritual lifestyle, trust me, the whole goal of the NCLEX is that we don't argue, we don't judge, right? What we do as a nurse is to implement this into what their plan of care. Any cultural thing of the patient, we don't ask them why are they doing this, so. We just implement it into their plan of care. right? In as much it's not something that goes against nursing principle, right? Like now, a patient Jehovah Witness don't want blood transfusion. The only thing you just do is to educate them about the risk, and then what? Document that they don't want it. Simple. Right. We don't argue with them and say, oh no, you are going to die from this, you are going to this, you need to have it, so. No, that is what they want. Implement it. That's what NCLEX wants you to do. Implement their spiritual life and their cultural aspect as well to into their plan of care. So if I see any particular question that is talking about a patient culture and spiritual life, I just implement it straight into the question. Like I just select it as the correct answer. I move on. Right. That is how the NCLEX works. So this is settled. This is settled. Now, caring. Caring question. Now, funny enough, when I saw caring question, I thought it's question that involve giving medication, treatment, procedure, and other kind of stuff. I was shocked that caring question don't involve treatment, it don't involve procedure, and any other kind of aggressive way of caring for patients. Caring just involve what we call interaction. That is what caring question involve interaction. Right. So on the NCLEX exam, if you see any question that what involve what interaction, that is a caring question. Interaction or something that is going to cause. Let me put something. Let me say something that is going to cause interaction. Like now, for example, now NCLEX is saying, "Oh, you entered the room of a client and you saw the client crying. Are you going to give the client medication for crying? Are you going to give a patient medication? You entered the room of a patient, right? As the
Mhm.
nurse, and you saw the patient, she's crying. Now, are you going to give this patient medication for her crying?
No.
All right. So, what are you going to do? What are you going to do? A patient is crying. What are you going to do?
Ask them why they crying, intervene.
We don't ask why question during interaction. Right. That is no correct for nothing. Now you interact with them in a therapeutic manner.
No.
Right. The first thing you are trying to do is to acknowledge what is happening. I can see that you are sad. That is the initial thing. I can see that you are sad. Right. Would you like to share with me what is going on? I can see that you are sad. I am here with you. Right. We don't ask why question or start with question. We try to acknowledge first. Right. So now if you answer question that involve if you see question that involve caring, it all involve what we call interaction. Either the NCLEX is saying the nurse and the client is interacting, or the nurse and the spouse is interacting. Anybody that the nurse is interacting with, that is a caring question. Or any situation that can cause the nurse to give a response, that is interaction question. Or you are going to see on the NCLEX exam, NCLEX is just going to put in quotation the patient statement. Maybe the patient says, I am tired of life. I feel so sad about everything that is going on. Or they say the nurse is caring for clients who have so. And when the nurse asks, patient replied, and they put the patient reply in quotation, this is a caring question. Or the NCLEX is asking you about confidentiality, privacy, client need, all that kind of stuff. That is a caring question. All those things don't involve giving medication, treatment, and all that kind of stuff. Advanced directive, that is a caring question. In fact, any question that don't involve treatment, they are caring question. I'm only just telling you the common ones that are on the NCLEX exam. Right, but any question that don't involve treatment or any form of procedure, trust me, that is a caring question right there. So now you want to know all the kind of caring question, and how can you know that? If you just go and check the NCLEX test plan for RN, or if any student is taking PN, right? You are going to see the the information. Now, those information on the test plan, you can easily know which one is going to involve treatment and which one will only involve communication. That is how what the NCLEX work. So communication is what? Hearing. Right, that is caring type question. We use communication to solve the patient problem or make the patient feel safe. Like now, if a patient is sad and I communicate with the patient, that way I can understand what is going on, and then solve the patient problem. Because if I leave a patient that is sad, the patient is sad, I cannot give this patient medication to solve their sadness. No, I can communicate to solve their sadness. And guess what? The safety concern behind sadness is that these patients can feel so depressed at the end of the day and be at risk for what? Suicide. So, but what am I using to solve the sadness? Just my communication. Right. So the safety aspect is how do you communicate to a sad patient that make them what? Feel comfortable. So, but a lot of students might not see that there's a safety concern there. That's why every NCLEX question is built around safety. You just need to understand the safety way NCLEX tests the question. Right. The safety way NCLEX what? Test the question. Your nursing process is definitely your 8 assessment, diagnosis, planning, intervention, evaluation. But NCLEX only focus on assessment, intervention, and evaluation. Now, NCLEX test assessment separately, NCLEX test intervention separately, NCLEX test evaluation separately. Right? It's not that, oh, in a single question, NCLEX is testing you on the three. No. Evaluation questions like NCLEX is saying, which of the following is the expected response? NCLEX is trying to test you about evaluation, or which of the following should you follow up? Follow up, immediate intervention, immediate action. Right, those are what? Evaluation type question. Those keywords speak what? Evaluation. Now, NCLEX can test you on intervention as well. To tell you you are creating a plan of care. You've seen all these questions, right? A plan of care. NCLEX you are trying to create a plan of care for clients who have so. Which of the following would you include as an intervention to what? The plan of care. That's how NCLEX write it. People that have taken the NCLEX exam before, they have seen this kind of question. Their intervention type question. Now, if it is assessment, NCLEX try to trick you assessment and intervention together. But assessment question can also include intervention. It depends on the it depends on the symptom the patient is experiencing. Now, if the patient is experiencing mild symptom, then what we are trying to do is what? Assessment. But if the patient is experiencing life-threatening symptom, we are going to skip assessment and jump straight to what? Intervention. So that's how NCLEX play a tricky one on assessment, right? Right. So, but that is that on what your nursing process, your clinical judgment question for real, that you know that already, because that is your recognizing clue, analyzing of the clue, prioritizing hypothesis, generating solution, taking action, and evaluation. That is your clinical judgment question. Your culture, no, sorry, this is communication and documentation. This part as well is straightforward. Communication involve the nurse, the patient, the nurse and staff, the nurse and healthcare team. So how do you communicate? That is just all the NCLEX is testing you. Why do we communicate? To avoid medical error. So every of your communication on the NCLEX exam, any question that involve communication or anything that involve communicating, NCLEX prioritize that. We teach client how to communicate. Like now in pharmacology now, in pharmacology, the biggest aspect of pharmacology on the NCLEX exam is communication. How do we teach the client to communicate to their healthcare provider about the adverse effect that they are experiencing? That is the reason why if you check on the NCLEX exam, if any question is saying report this to your healthcare provider on a pharmacology question, even if I don't know about that medication, I will select that answer because I understand the NCLEX concept of communication. That is a very important answer for the NCLEX exam. So even if I don't know about that medication, that answer will be 100% correct all the time. All the time. Now, that is how the NCLEX work. Documentation as well too. I will just look at my answer key. NCLEX can test you documentation straightforward in a form that NCLEX want. There are some certain things that need to be documented. That is one. Two, NCLEX can test you how to document some certain procedure you carried out. And three, NCLEX can give you answer key and give a certain answer related to documentation to see if you know you need to document that particular thing. Just select it. NCLEX don't just put documentation answer for fun. Right, if it's a documentation question, NCLEX don't also put ask you NCLEX can ask you documentation straightforward and say, oh, you inserted IV access, how would you document this? And they will give you different form of documentation. You need to select the correct documentation, right? Or you have a select or apply question and you have one answer that asks you to document, select it, it's correct because it's a normal practice for us. So that is just the concept. Now, if you build this concept into your 85 question, trust me, it will be difficult for you to fail the NCLEX exam. That is how the NCLEX definitely work. Now, your NCLEX practice question, right, which is your program question, they don't test you based on the concept. They only test you based on trying to answer as much as possible question to make you prepare for the NCLEX exam. That is the mistake of program. They give you as much as possible question, right? Testing you on some certain content, hoping that once you finish the whole, maybe let us take for example 2,000 questions, you are ready to what? Pass the NCLEX exam. That is how program work. Program is just trying to fill you with a lot of questions before you started preparing for the NCLEX exam. Maybe this is your level, right? So they try as much as possible to fill you all the way with 2,000 questions up, so that they feel like you have as much as possible enough knowledge in order to what? Achieve passing. But guess what? This same program this student A got is the same program student B got. They both got filled up, but student A passed and student B what? Failed. Same program. So what's the problem? The problem is not the program. The problem is the approach of the program, because one can easily use the approach, another one cannot easily use the approach. But trust me, these two people, if they maintain one secret approach, the both of them will pass. And that secret approach is understanding what? The NCLEX, how the NCLEX work. The moment these two people can understand how the NCLEX work, they will use any program and both of them will pass. Not only passing, they will pass in what? 85 questions. Now, the NCLEX is this. The first thing you want to understand about the NCLEX is what the NCLEX is all about. Now, the NCLEX we want to test you as a safe nurse. I said previously. Now, how do they do that? They do that using what? The six concept we talked about earlier on. Now, this six concept is distributed into 8 client needs. And what are your 8 client needs? You have your management of care, safety and infection control, health promotion and maintenance, right? Your psychosocial integrity, your basic care and what? Comfort. You have your reduction of risk, you have your pharmacology, you have your physiological adaptations. 1, 2, 3, 4, 5, 6, 7, 8. So these are the 8 what? Client need right here. So this 6 concept, we have it in each of these 8 what? Client need. Now, the moment you can understand this 6 concept, you can see how NCLEX write the question in each of this area. Now you can already even understand how NCLEX can ask the question, and you are preparing towards similar questions in your mindset like that. That way, you are not reading a whole textbook. Instead, you have a focus right now. You are focusing what? 6 concepts, the 8 client need, and now NCLEX can test it. Now you are not reading something as much as this, that your reading is just like this compared to this whole thing. Now, this is what I call being smart. Now, next thing you now want to understand is how NCLEX what? Write the question. Now, NCLEX use 3 structure in writing every question. Right. First structure, second structure, and then your answer keys. 1, 2, 3, 4. The first structure is what we call the body of the question. The second structure is what we call the stem. And this one is what we call the answer keys. The body of the question, the reason why the body of the question is there is because all the content you got from the 8 client need, right? Like for NCLEX RN, you have 146 content, 146 content. Now, all this 146 content, NCLEX describe this any of this content. If NCLEX want to test you on any of the content, it's on the body of the question that you are going to see it. That is the reason why you need to understand the body of the question so well and understand the 146 content. Because the moment you understand the 146 content, you are going to see it in the body of the question. Now, when you look at the body of the question, you are going to say, okay, based on the body of this question, this is what the NCLEX is testing me on. So you have an idea what the NCLEX is what? Testing you. Right. Now, the stem of the question is what we call the examiner what? Question. Because the body of the question is not your question. The stem is the question. The stem is the question. Right. So now, the stem of your question now asks you a question in regards to that content that you are saying on the body of the question. Right. Because the stem now asks you, maybe let us take for instance now, the question is testing you. Let's say the body of the question is testing you on confidentiality. Now, the STEM will now ask you, maybe they say, you are you attend a staff education program about confidentiality. So this is a what? Learning type question. Now, the STEM will now say, which of the following would you or NCLEX can say, okay, let me not use that one. NCLEX can just ask, like the examiner question might be, which of the following statements indicate a correct understanding? NCLEX can just utilize that. Now, guess what? NCLEX is trying to make you select the correct understanding related to what? Confidentiality. So now there are going to be 3 answers that is going to be wrong related to confidentiality, and then 1 answer that will be correct related to confidentiality. Now, maybe one of the options is like check audio patient nursing note. That is wrong. Only the assigned nurse should check what? The patient nursing note. Or when you are communicating the patient's information, speak out loud. We don't speak out loud. We lower our voice. Now, patient should give all personal information to receive care. Patient don't give all personal information. They only give specific information related to the care that they want to get. And maybe another answer is telling you to discard all unused worksheets related to the client. That is good because we are trying to protect what? The client information. Right. So that is how the understanding of what the NCLEX is testing, understanding the examiner question, and then breaking down the answer key will now make a lot of sense. Right. Now, that is the STEM. Now, the answer key, a lot of students will complain, oh, some of the answer keys, some of them are similar, they look correct, this and that, everything look correct and something like that. Why? Because NCLEX like to write answers 70 to 100% correct. I created this concept, right? Because I don't know the best way to explain it. So that's why I use this concept. NCLEX like to write answers 70 to what? 100% correct. Now, NCLEX can write a certain answer, and then right here, NCLEX is just going to have the wrong word that make this whole answer what? Incorrect. Remember, NCLEX exam is about what? Safety. Now, because NCLEX exam is about safety, even while writing the answer key, NCLEX writes some certain answer key to look 100% correct, but just a keyword 70, we look 70 to 100% correct, but just a keyword that make 30% of that answer key will make the whole answer wrong. Like now, I saw on the NCLEX exam, the NCLEX said exercise once a week to stay healthy. Now, tell me what is wrong about this answer key. Exercise once a week to stay healthy. Tell me what is wrong about this answer key. I want to hear from you. Exercise.
Once a week.
All right. Once a week is what is wrong about this answer key. Now, guess what? Look at how the NCLEX write the answer key. NCLEX put together the answer key It makes sense. Now they are playing against your thinking. Now the first thing you are saying is what? Exercise. Everybody know exercise is good. But guess what? Look at another thing that is also killing you to what? The first keyword you are saying, which is exercise. Exercise to stay healthy. Now, exercise to stay healthy is correct without this. But with this, it's wrong. But the way nursing students think, we still think like we are in nursing school. We don't think about the importance of we don't only focus on the importance of exercise. We focus on doing it right. Everything in nursing is not about the importance. Like now, I can give a patient anti-hypertensive medication just because I want to lower their blood pressure. But guess what? The importance of giving anti-hypertensive medication is to low blood pressure. But guess what? I don't still give some certain medication to some certain patients if they are what? Contraindicated to that medication. So it's not about the importance of the medication of what we want to do. It's about seeing if it is safe to do or if it is going to be effective. Yes, doing exercise is good to stay healthy, but once a week is not effective because the right exercise should be 30 minutes each day for what? 5 days. Antihypertensive medication to reduce blood pressure is good, but guess what? If I am giving beta blocker to a patient who have asthma, then it become a problem. So it's not that the patient who have asthma don't have hypertension, because NCLEX can tell you the history of this patient is what? Hypertension, asthma. NCLEX can tell you this is the history of the patient, and they tell you the patient blood pressure is 152/72, and they have medication, and their medication is what? Beta blocker. And NCLEX is asking you which of the following medication should you give. Now NCLEX is telling you about maybe and then one of the answer key include beta blocker, and then you are like, but we give beta blocker for hypertension. Why is NCLEX putting it? So what's not the correct answer? What? You are now lost because you don't understand the exam. You are not thinking like a nurse, you are still thinking like a nursing student. In nursing school, nursing school question is going to test you on the correct medication to give for a patient who have hypertension. So they are going to mix both medication for MI and medication for heart failure, medication for hypertension, medication for diabetes all together in your answer keys. That's not how NCLEX work. NCLEX can test you on hypertension and give you all your 4 options to be hypertension medication. That way, you understand that NCLEX is testing you about what? Contraindication. It seems there's a certain medication in this list that is not
Mhm.
safe. That is how the NCLEX work. That is the exam. Safety, safety. Let it ring all the time. This is how the NCLEX works. Now, there's a particular option as well too. We are still talking about NCLEX writing answer 70 to what? 100% correct.
100.
Now there's a particular answer. Question, right? Engle said you are preparing to give what? Blood transfusion. Which of the following should you do prior to the transfusion? Now, there's a particular option that said verify with another nurse using the client room number and ID band. Now, tell me what is wrong about this answer.
Room number.
Room number. So this is what is wrong about this answer. Guess what? Now this is what NCLEX is using to trick you. Verify with another nurse. Before we give blood transfusion, we 100% verify with another
Mhm.
nurse. We use ID band, but we don't use room number. So NCLEX is not all about what you know it's correct. NCLEX is, can you spot what make this answer wrong? This is how the NCLEX work. So if you are going on the NCLEX exam and you want to be questioning every option, you are still thinking like what? A nursing school student. And guess what? This is what program is not telling you. Because all you just do is to just buy the program. Maybe you pay $159 for the program. You buy the program. Guess what? After buying the program, what happened? You start using the question bank. You start telling yourself, I will do 50 questions each day. You finish each question without not even understanding what the NCLEX is all about. All you just understand is the rationale for the wrong answer you've answered. Now on the NCLEX exam, you are on your screen right here taking the exam, and funny enough, your question one answer, you don't know how to answer it. You are terrified. You now feel like the exam is difficult. Now, next question, you are thinking about it. You second guess on this, and then you move to the next question, and then it's the same story. Then you end your exam in 150 question, 85 question, or anywhere between 86 to 149 question, and then you are out of the exam and you are like, you are not sure. Then the result came out, fail, and then you are like, exam is difficult. Because trust me, after doing 2,000 worth of questions and still end up failing the NCLEX exam, it's difficult to recover from that. It only take what? The grace of God most times for most students to recover. Because right now, they feel like they have done everything right, but at the end of the day, the result is not saying something like that. That is the reason why instead of using program blindly, right, you need to understand the NCLEX exam. That is what I feel. Right, you need to understand the NCLEX exam. Instead of using program blindly, the first thing you need to do is to try to understand the NCLEX exam. The moment you can understand the NCLEX exam, right, you will succeed very well. Now, then you can use program. Understand the NCLEX exam, you can use program, then you understand. Then that way you will now start seeing a lot of error program are making. Right. I've not even got to the part whereby I need to even tell you that a lot of program make students fail case study because they don't know how to present case study the way NCLEX want students to know case study. Let's not even go there. But now let's talk about the NCLEX what question. Now, NCLEX question is written in what? Three structure, as I said. Right. The body, the stem, and then what? Your answer keys. Right. The body, the stem, I explained the stem already, and then you answer keys. Now, this is your standalone question. If you select other apply as well to this, is still your answer key. Now, if it's your case study, or let us say if it's your bow tie question is something like this. You have the other information here, then you have the box, the box, the box, the box, the box. Right. So you have something like this right here. Then you have one box right here, one box right here, one box right here. This is your body, this is your stem, and then this is what? Your answer keys. Right. If it is case study, right, as well. So case study is divided into two parts. You have your box right here for information right here. Then you have this, you have your answer keys right here. So body, stem, and then answer keys. So everything all work like that. Every type of question, they have body, stem, answer key. Remember, the body of the question is to get the content. Because if you have gone through the content for the RN exam, RN have 146 content, LPN have 150 content. If you have gone through the RN content, then you now already know what the NCLEX is testing. Now, on the content, NCLEX just give you the content. Now, you need to go and look for resources to study those content, right? That is just about the content, and most of the time a lot of students don't have the right resources to study this content. That is the main reason why they just like ignore it. Most of the time they say okay, they follow program and all that kind of stuff. Right, there are a lot of ways to study the content. You definitely have Google right there that can give you an idea of what the content is testing. You don't need 100% knowledge of that content, you just need 70%, and you are good to go in passing the NCLEX exam in its 5 questions. Now, when you are done with the content, you can now be able to understand that, oh, this body of this question is testing me on this. Oh, this body of the question is testing me on that. Now you have an idea what the body of the question is testing you. Now you can now go and read the stem, and now read the question the examiner is asking in regards to what? The stem. Now you understand the question, examiner question in regards to the stem. That way you can now brilliantly now look at the answer keys, create what extra understanding, because this is what I tell a lot of students. You look at your answer keys to create more understanding of the question. That's what you use your answer key to do, to create more understanding of the question. Now, when you have that more understanding, you can now use the principle of elimination. Right, I teach this well in my program, elimination. Now, we don't this is what I do. I don't look for the correct answer. Instead, I look for the wrong answer because it's easy to spot the wrong answer than the correct answer. The wrong answer always makes sense that they are wrong. But the correct answer, and NCLEX, they are tricky kind of people. They put the answer in a way because they want to test you to be a safe. No. So the way they put the answer, they want you to feel like to get it correctly, they want to be satisfied that you are a safe nurse. So people that pass the NCLEX exam in 85 question, anywhere between 86 to 149 question or in 150 question, they did a great job. Right. But I can guarantee you 100% is you can easily pass the NCLEX exam what in 85 question, and that is what I want to show to you. Now, the first concept is your approach to the exam. One, your approach. Now, you must be serious. Let's say a lot of students will say, "Oh, trust me, coach, I'm very serious." But are you ready? A lot of people are serious, but they are not ready. Serious is showing up for the exam, but readiness is you are not ready. Now, I was coaching a particular student, and the student was like, "Oh, I don't have any pressure right now because I know I'm not taking the NCLEX exam yet. When I'm ready to take it, I will definitely take it. All I just want is just to be gathering information about the exam." So this student is showing up for classes, but they are not ready yet. And seriousness and readiness work together. You cannot be serious and not be ready at the same time. You are deceiving yourself because seriousness, readiness equal results. But if you are serious, you are not ready, then you cannot get what? Results. You understand? If you are serious, you are not ready, you cannot get result. It's just like right now, I'm serious about getting married, but I'm not ready to get married. How will I now be able to get married? I'm serious about getting married, but I'm not ready yet. So how will I be able to get this result? It's not possible. I cannot attain the result of having a wedding or something like that because I'm not ready. This is the problem right here. And that's the reason why a lot of people don't get that desired result. Now, this is the biggest problem now. Remember, they are serious, right? They are not ready, but life can get at them and turn this seriousness into urgency. Now, life can get at them whereby they are going to turn that seriousness into urgency. Now, the person that is serious before that is not ready, all of a sudden want to take the NCLEX exam, and you're asking them why. They tell them they will tell you it's because of bills, loans, debt. That is the reason why they are taking the NCLEX exam. So, is bill, debt, loan a result of readiness? No, because you are only taking the NCLEX exam because you want to clear this out. And guess what? That is not readiness. So if you are serious and this is what is making you to take the NCLEX exam, this is what you are going to get. Fail. A particular student scheduled the exam December 17th. Right. I told the students, I'm not really sure you are ready to take this NCLEX exam because if you go take this NCLEX exam now, there's possibility you are going to fail. We did 10 questions together. You only scored 1 out of 10. That is terrible for the NCLEX exam. And we are not just answering random questions. We were answering NCLEX past question. NCLEX past question. So if you're answering NCLEX past question and you only score 1 out of 10, you are not ready to take the NCLEX exam. She said, well, thank God that I have you as a coach. If I take this NCLEX exam and I fail, I can pay you to coach me and I will be able to pass. I said, it's not about paying me to pass. It's about wasting what? $200. Instead, you can shift the exam and then pay me the 497 to join my program for 60 days, and then we can now reschedule a suitable date for you to pass the NCLEX exam. She said, well, there's nothing wrong in getting first-hand knowledge about how the exam look like. That way she can even more relate to what I'm saying. And well, I'm not about to talk you into what you need to do for yourself, right? We've grown. So she said she's going to take a try at it and something like that. And then when she I asked her, why are you rushing to take the exam? Can I know? She said she's want to take the NCLEX exam because she needs to leave the current house that she's staying. They want to what? Sell it. So in order for her to leave, right, they should have sold the house long time ago. I guess she said November 19th or so, but she had to uh I don't know, it's a complicated story. She said her aunt owns the home, but she had to beg her aunt to wait that she will take her exam on the 17th of what December. And when she's done taking the exam, she's going to leave and something like that. She don't want to stress herself out thinking about preparation, all those kind of things. Like she don't want to distract herself. That's what she said to me. I said, but I feel like if you are rushing to take the NCLEX exam, you should tell me that you are ready. But
Mhm.
right now, everything you are telling me, they are not related to you being ready, but you are trying to take the NCLEX exam due to what? Situation. And situation don't give you results. Situation don't give you results. It's just like in life. Most people lack what? Love. But because they are seeing a particular guy telling them how much they love them, they jump into the guy, not even knowing that the guy is a bad person. And at the end of the day, they enter the situation just because of the love, but they are unable to evaluate if this is right for them, and everything become toxic for them. Right. So situation don't lead to good results majority of the time. And then she took the NCLEX exam and she said, Favor, you know what? I failed. But I understand. Now I can work with you. She paid the she paid the 497, joined my program, and trust me, we had the whole teaching for I guess 47 days, and she passed the NCLEX exam in 85 questions. This is somebody who failed the NCLEX exam previously before in 85 questions. When I saw a test report, there were a lot of below the passing standard. Right. And I was like, okay, we need to work on this. And we did all that. And she passed the NCLEX exam in 85 questions. Currently, right now, she's working in a med surge cardiac floor in
Mm.
Florida. Now, so passing the NCLEX exam is not difficult when you know how to go about it. Right. So the first aspect is the content, as I said, understanding the content, knowing how, because it's three reasons. People fail the NCLEX exam due to these three reasons. One, they don't know the content for the exam. As I tell students, be familiar with what the NCLEX test plan, because that is where the content is. Now, the second part is knowing how the NCLEX write the question, and the last part is now trying to understand the mindset of the examiner. If you can do these three things, you will be so unstoppable. You are going to take the NCLEX exam. The exam is going to be tired of you. Have no choice to stop your exam what in 85 questions. Now, the strategy about the 85 questions is now understanding which parts of the exam have the most questions. That's why I focus on 5 key areas. Now, when I build you, drill you in this 5 key area, there's no how you are going to fail the NCLEX exam, because this way you have this 5 area are 73% of the exam. So if you have 73% of the exam and you only need 51 over 85 to pass the exam, right? Let's do the math. Now 51 divided by 85 multiplied by 100. So 51 divided is 0.6 multiplied by 100, that is 60%. So if it take you 60% to pass the NCLEX exam, and then we already cover a 73%, how would you fail the NCLEX exam? You definitely will pass the NCLEX exam what? In 85 questions easily. So that's why I focus on what? Not only making you understand the content, I also focus on letting you know how the NCLEX write the exam and how to break down the answer key. Then we go the smart way by focusing on the top 5 area. Then I break down what? Case study, right? And then bow tie question. These 2 area, you cannot escape it on the NCLEX exam. It's 100% on the NCLEX exam. So if you have that strategy that make you pass both eye and case study, in addition to this 73%, trust me, like you have the license at the end of 85 questions. Your license is ready. You get the message. You don't have to do this anymore. You proceed in life. Right. No more extra $200 and other kind of stuff. But the only initial investment you just did was what? $497, and that was it. Right, just invest in knowledge, right, and you're able to learn. That is how we approach studying for the NCLEX exam. Now, as I said previously before, right, the NCLEX exam is what? Your, what are they calling it? Prioritization. Big on prioritization. So there are key things you need to know about prioritization. One, you need to know that prioritization is in your maternity, peds, emergency department, medical condition, or let me say med surge, right? Peds, we have disaster. So one, two, three, four, five. Now this is where prioritization comes in all the time. Now, the way you answer prioritization under maternity is different from the way you answer prioritization under PITS. The way you answer prioritization under emergency department is different from all this. Like every prioritization right here, they are all different. The way you even answer medical condition prioritization is different from the way you answer surgical condition prioritization. Now, one key thing about prioritization that bring everything all together is one, vital sign, complication, life-threatening situation, right? Complication don't mean the patient is going to die. It might be something that causes discomfort or something like that that might lead to life-threatening situation. Life-threatening situation is that this patient, yes, like if we don't do something now, this patient is going to die. Yes, some complication are life-threatening situation, but I like to separate them from each other because complication might just be um you insert urinary catheter and then patient have what? Infection. That is a complication of urinary catheter. And then you might have a patient, same patient on that list of prioritization, that have low blood pressure, right? 90/60. Now this is a complication of urinary catheter, but it's not priority over a patient who have 90/60 blood pressure, because that is what we call life threatening. That's why I separated it like this: vital sign, complication, life threatening situation. Right, because these are everything NCLEX tests you on prioritization. I don't know what else NCLEX want to test you, but these are three things. I can guarantee you 100%. Every prioritization question, this is the goal: complication, life-threatening situation, vital sign. Right, is it that NCLEX is testing you on complication, life-threatening situation, vital sign? Now, I can break all this into further more areas, but not in this and what are they calling it? Definitely not today, right? But I'm just giving you the overview now of it, so, for everything now. But what I'm just going to leave with you today, right, is one big thing about prioritization is what we call timing, right? Time. Or let me just say time. Now, time is not time is broken into when NCLEX say 1 hour, 2 days. This is a form of time on the NCLEX exam. um Admitted, patient is newly admitted, this is a form of time as well too. Or NCLEX is using keyword like new, recent, onset, sudden or suddenly, experiencing, what is new, recent, onset, sudden, experiencing, worsen. I don't want to miss anything. New, recent, onset, suddenly, experiencing, worsen. This is what I can remember for now. Right. So now this keyword, if you see this keyword on the NCLEX exam, don't even think twice. NCLEX exam, that's what I'm saying right now. NCLEX. A lot of program are doing things that I don't understand. I'm talking about NCLEX, right? Because some program make a lot of students don't understand a lot of things, because most people only write question based on their mindset. NCLEX don't write question based on their mindset. NCLEX write question based on textbook and nursing knowledge. A lot of tutors will just think about it and say, oh, I want to test this student to see if they will likely select this answer because this answer is life threatening. So they are setting questions based on their mindset, not based on nursing principle, textbook knowledge, or what? Nursing concept. So that's the reason why they miss out the concept when they are writing the question. But NCLEX always include the concept because those concepts make one be a safe nurse. Right. So these are the keyword. A patient that is admitted, right? If you see on the NCLEX exam, NCLEX is saying, oh, this patient is newly admitted, select that answer. That is your correct answer based on prioritization. Or you see your NCLEX prioritization question, anyone is having all these keywords, select that. That is your answer. Right, or maybe NCLEX is using exacerbation of asthma, exacerbation of COPD, exacerbation of heart failure, exacerbation, that keyword, screen, pick me, pick me, pick me, pick me, pick me. Right. Now, 1 hour, if everything is all about time, right, if everything is all about time and there's no life-threatening situation, maybe we can fall back to the patients that have the recent complaint. Right, that is about 1 hour, 2 days, and so like that. That is about the principle of time. But at least we need to do practice to even understand them deep, or at least you can see them and then be able to understand, oh, this is about it. Now, the last thing I'm going to leave with you, right, before I
Mhm.
end the Zoom, is this. Um, NCLEX can give you prioritization. I want to tell you the criteria of prioritization. Now, every prioritization question should include the condition and the symptoms, the or the let me not say condition, because it can either be a diagnosis or a surgical condition. Right, a diagnosis or a surgical condition and the symptom. There's more that is included in your prioritization, but most especially you should include the condition and the symptom. Now, guess what? If NCLEX don't give you the condition, let us say we have four answer keys. Okay, I have this answer key. Let's say we have four answer keys: one, two, three, four, and then these three, they all have what? Condition, but this one don't have condition. This is definitely going to be your answer. You've not even on the you don't even understand as at yet what is going on with each patient, but because of you saw that these three have condition but this one don't have a condition, that is your correct answer. Because these ones that have condition, they have already gone beyond what we call assessment, knowing what their diagnosis is all about, and then they are receiving maybe a certain treatment, but right now they are just experiencing something. But this particular patient that don't have a condition, it means that we don't even know what is wrong with them. We only know their symptom. So we need to see this patient, start with the whole assessment process, find out their diagnosis, and then start to care for them. Because this patient, we don't know anything about them, but these patients we already know something about them. So that patient that don't have condition, they are always priority. NCLEX writes questions like that. And then NCLEX can also do the reverse as well. So NCLEX can just put only one option, and then this one option we have condition, and this three we have no condition. That way, we now want to look at what the patient is experiencing. Trust me, two of those patients is going to be stable and one will be unstable, because NCLEX might tell you, oh, you saw this particular patient, but the patient blood pressure is 110/60, or you saw this particular patient, their blood sugar is 70, and this particular patient, maybe their oxygen is 81%. They don't have condition, but you use what they are experiencing to find out this blood pressure is okay, this blood sugar is okay, but this oxygen is bad. So we now say that answer. But guess what? The one that have condition, we eliminated it. We are not thinking about it because the other three don't have condition. That is also a way the NCLEX works. So with that being said, yeah, I'm going to definitely end this session now. And then when we meet again, we're definitely going to talk about a lot that you need to know for prioritization and
Mhm.
passing the exam. So, with that being said, any question?
The only question when you were is talking about caring question, did you mention you said caring question or we start with interaction or intervention? I just wanted to clarify.
All right. Caring question, right? On the
Mm,
NCLEX exam, a question that involve interaction,
okay. Mm,
no treatment. Caring question don't involve treatment. Like if you see any question that will make you treat the patient using either certain procedure or medication, that is not caring question. Caring question involve just interaction,
okay.
communication with the patient, right?
Okay.
Privacy, confidentiality. Okay. Caring question involve, like now, a patient that have mental illness, right?
Mm-hmm.
And then maybe a schizophrenia patient, and then they started telling you, oh, they are hearing a particular voice telling them so and so. That is a caring question, because you cannot give them medication. You just need to communicate to find out what the voice is saying, right?
Mm-hmm.
Is that not so?
Yeah.
Right. So, and then they tell you what the voice is saying, and then from there you can evaluate if they are safe. Now imagine if the voice is saying they should kill themselves, you can easily know, oh, the patient is not safe. You can see that question You don't need to involve medication. You just need to communicate, and all of a sudden you find out that that question is involving what? Safety answer. Right. So that is how the NCLEX work. Caring question don't involve treatment, it's just interaction. It can be interaction between the nurse and the staff, nurse and the client, or nurse and other team members. Right. So pay attention to it. It can be interaction between nurse and a fellow, as I said, a fellow colleague. It can be interaction between nurse and spouse. Anybody that the nurse is going to interact with, or any scenario that will make the nurse to interact back to the patient, they are all interaction question. Most especially if it's a interaction question, you will see NCLEX putting in quotation the patient statement. So you know it's just an interaction question. NCLEX will trick you with the answer keys, putting answers related to treatment. But since you can identify that that question is a caring question, you will definitely know select answer related to treatment. And that way, that's a smart, because now you know it's a caring question and you will just easily eliminate answers related to what? Treatment, and focus on the ones that involve just communication. Right. Any other question?
Oh, that would be it. Thank you.
All right, no problem. For sure, I'm going to show you samples of all these questions and we are going to go through them together. But definitely, tomorrow we are going to cover prioritization in full. Right. We are definitely going to cover prioritization in full. And then you will understand much about prioritization. So, with that being said, I'm going to stop the Zoom now and I will meet you again tomorrow. Bye bye.
Thank you. Have a good day. Thank you.
All right, bye.